Ashley is another body worker. She does massage therapy and like many body workers gets tension accumulating in her upper body. Today, it's been several months since we've worked together, so there's been an accumulation of tension in her neck and around her left elbow, especially noticing that when she's doing body work. So we're gonna do an upper body treatment here, and we know Ashley does better without cervical manipulation. That gives her a headache, so we're not gonna do that. And we're gonna focus on joint function. We're gonna probably do some ligamentous releases through the neck and shoulders and clavicles. And we're gonna have a good look at the myofascia of the left forearm. She's having medial epicondylitis, so the wrist flexors are what attaches right there, and she's breathing really well. My initial survey here is that great muscular development. Have you been working out?
Just work.
Right, just work. Yeah, hard working. So lots of muscle in the upper body. Things feeling really pretty smooth and mobile. Nothing really jumping out at me as being obviously misaligned or dysfunctional. Let's get a nice slow palpation up the spinous processes. Beautiful breath. Really good job there, Ashley. Keep breathing. Really nice. Good. So as far as the spine goes, from T12 up to T1, I'm not sensing any misalignment at all. A little bit of tension and restriction through this section here. So as part of any upper body session, we're going to do some rib work. And I find a lot of times when there's restriction of a whole section of the middle thoracic spine, a lot of times that's really coming from the ribs, and the ribs not being as mobile as they could be. I know from my own experience, when you're pushing a lot and doing body work, it's the serratus anterior that takes a lot of that. So you can see that little twitch response right there on her left serratus. And we're getting the same thing over on the right side. So there's some trigger point stuff in there. So far so good, Ashley?
Doing great.
Great. So let's start with this left shoulder and arm. So what I want to do is make sure that we had good movement between the scapula and the rib cage right here. So I'm getting a little traction on her arm and a little bit of a push on her rib cage here, and make sure that that scapula is moving really well. Nice deep breath in and out. On this next in-breath, I'm going to help her lift the ribs a little bit, and the shoulder blade comes up, and then breathe out and we descend. Good. So helping the rib cage and that serratus anterior and latissimus induce good respiratory movement. Yeah. One more time. Good. Beautiful. And let that out. Great. We're going to work down the arm and gentle traction, not squeezing, right? Just a gentle, kind of just the weight of the arm. I'm pushing up a little bit, and you can see there's just a little traction on the shoulder. We come down to the elbow, and this is the area that's bothering you. Okay, so let's have a look here. There's no redness, there's no swelling, so it's not injured. I got her medial epicondyle right there, and yeah, that's the tendon. They'll call that the common flexor tendon. It's pretty tense. So let's open that up a little bit. So you can see I've got my middle finger on the wrist flexor, giving it a little traction. And I'm going to extend her wrist and just get a little stretch through that tissue. So I can't undo. How many massages a day do you do?
6 hours.
Yeah, 6 hours a day. But what we can do is help get some circulation through there. Her tissues are essentially healthy. It wants to be pain-free, and we just need to kind of give it a little bit of a nudge. And that's it. So a little more traction now. Hooking my index finger and getting a little counter pressure with the thumb. Is that pressure okay?
It's great.
Great, good. And it's a gentle pull and squeeze. Deep breath for me. Good, let it out. Nice. And let's work that more superficial fascia. So right here, so we can see there's the skin, and now I've got the superficial fascia, and now I've got the muscle. So we're looking at the junction of the superficial fascia and the muscle and finding some restriction or adhesion really right there. So that's kind of a classic overuse thing. And I'm sure we would find lots of the same things in my forearms. Because bodywork is manual labor. It really is. It's an inside job, indoor job, and you get to stay clean, but it is definitely manual labor. Just a little bit more here. Get some movement right there. Boing. Good. Great. We're going to do similar on the right side now. Rib mobilization, scapular mobilization, shoulder traction, and then releases down the arm. So bringing it up like this, nice deep breath, and let it on out. Good. So it's definitely a little restricted through this section here. It's these ribs coming down this way. So let's get a little traction. You can see her scapula really nicely right there, right? When I pull on her arm, her scapula comes with it, and I'm going to use my other hand to provide a little counter pressure just like that. Getting a deep stretch, but really gentle. It's very safe for the shoulder. And with my thumb, you can see I'm really hooked onto the latissimus here and pulling it off of the serratus, and there it was released a little bit. Oh, yeah, right there. Deep breath. Good, and let it out. Good. Good. Let's do that one more time. Good. Traction the shoulder. Thumb pressure. Just getting some movement between the serratus and the lat. That one was much smoother. Okay, deep breath. And all the way out. Immobilize them down. Good job. One more time. Okay, I got a nice grip on her humerus. And again, just the weight of her arm and the friction that we have, I can get some nice traction. Are you lefty or righty?
Righty.
A right-hander? Okay. Yep, great. Great muscle in the upper arm here. Yeah, it's nice. A little traction for the elbow. So I can grasp, kind of get her hand like this. And as you can see I'm pulling. It's gentle, but it's definitely a sustained traction. And we can get that deep tissue of the forearm to stretch as well. This little traction, putting a little extension through the wrist. And working the wrist extensors here. Mm-hmm. Good. Okay, let's check in with those thoracic vertebrae again. Nice breath. Really good. Good. Yeah, good. So more mobile through this section, but still a little bit tight. So you keep breathing. And on the in-breath, we're going to kind of give them a lift. And on the out-breath, a gentle pressure, P to A, just like that, no thrust. Breathing in and breathing out. It's like hand over hand, a little bit of my body weight, and just inducing some extension through that section. One more time. Good. Okay. Let's get you turned over. We've got her comfortably supine, and we're going to be working from the clavicles on up to the crown of the head. So yeah, tension through here. And yeah, so I think you said a brick.
Mm-hmm.
Yeah, okay.
Brick-like.
A little bit of a bricky neck. Mm-hmm. So okay, let's just see if we can open it up a little bit. So my left hand, I'm providing a little bit of forward push on the upper thoracic vertebrae, and with my right hand giving a little stretch to the pec here. Good. Nice deep breath here. Good. Breathe up in. Yeah. Really good. And let it on out. Good. And I like to have the patient's palm up when we're doing this, so it gives a little external rotation to the humerus and just like an extra half or quarter inch of length through the pec muscle. It really helps. So feeling like continuing this right on up the right side of the neck. On the scalenes here, always being really careful of the neurovascular bundle there. You can actually see her pulse a little bit right there. And good. So this is gentle traction, and the traction is affecting the deeper tissues, separating the vertebrae a little bit and stretching the deep scalenes a little bit. And then with my hand, stroking up and affecting more of the superficial tissues. And so now let's bring it up under the occiput here, and just a gentle traction on the occiput with a little bit of pressure onto those suboccipital muscles. Good. Here, that top inch of the SCM. Does that stretch okay? It's not too much?
Mm-mm.
Okay, good. There we go. And now we're going to bring that up. Yep. Over along the temporalis muscle. So still providing traction with my left hand on her occiput. And while I'm tractioning her occiput, I'm also lifting the temporalis muscle kind of up toward the crown of the head. Give that fascia a little bit of a stretch. Yeah, well, let's see how rotation feels. Pretty smooth up to about here. So the restriction is now much more on the left side because we just opened up the right. Nice, so some traction along the pec muscle. And a nice deep breath up into your chest. Good. And let it out. Nice. A couple more like that. again, left side scalenes, a little traction for the neck while we really gently sweep over the scalenes, mindful of the nerves and arteries in there. And now some traction through those middle cervical segments on the left side. Good. A little bit more trigger point stuff here in her left SCM. And again, not to like, what's the word I'm thinking? There's no need to kind of grind on those or wail on them. Just move some circulation through and help them get back to normal. Good. So we're going to work through that restriction of right rotation that we found on the left side by inducing this right rotation and with my fingertips just kind of like guiding the cervical vertebrae through the movement. And in that way induce better mobility without having to force it. Good. And bring that up over the temporalis, tractioning the neck, tractioning the temporalis at the same time. Good. Right there. Feeling like scalp tension in here. So giving just a little bit of a stretch to the scalp. Okay. Now, I'm going to finish off here with some straight up traction and bringing that up over the crown of the head. Again, a superior stretch of that fascia around the temples and the forehead. And say, thank you, Ashley.
Thank you.
I appreciate it.